Pozdravljeni.
Hello, I'm Boris Poberai, an orthopedic surgeon, and I would like to present to you the treatment of rotator cuff injury in the shoulder joint. Rotator cuff consists of four muscles presented in red: subscapularis in the front, supraspinatus at the top, infraspinatus, and teres minor at the back. All the muscles are connected with the bone by the tendons. What happens if you get hurt? For example, if you fall on your outstretched arm, or directly on your shoulder, or you caught your hand behind the fence when you slipped on the stairs, the tendon can tear at its insertion because the torn tendon is pulled by a muscle away from its insertion. It can never heal itself back to its footprint, and the defect slowly grows. Your shoulder hurts, especially at night. The pain outlasts your sleep. You also notice less strength depending on which and how many of the tendons you have injured. The X-ray imaging will not show the rupture. At least an ultrasound examination is required. Ideally, a magnetic resonance investigation. Clinical examination is crucial in a decision-making for surgical treatment. We do an arthroscopic surgery in the day hospital, which means that you are discharged home the same day. We use conductive anesthesia, scalene block, and do not need general anesthesia. The joint is not opened, but we rather use a camera and special instruments to enter into the shoulder through a few millimeter large incisions. The tendon is pulled back to the footprint and fixed with special anchors and sutures. The tendons then take 3 months to heal firmly on the bone, and rehabilitation is adapted accordingly. To keep the tendon tight in contact with the bone for the first 6 weeks, you mostly wear a detachable splint and do some simple exercises at home. 3 months after surgery, we will refer you to a rehab center for 14 days, where you continue intensive exercises during which you are able to perform most of the lighter physical work and daily activities. The final function of the shoulder will be restored within 6 months to 1 year after surgery. Despite relatively long rehabilitation, arthroscopic reconstruction of the rotator cuff are extremely successful, as 90% of your pain settles, as well as the function of the shoulder joint improves.
90% prav tako pa se vam izboljša tudi funkcija ramenskega sklepa.